Hey guys, Enock Rwamuza here. Welcome to the fourth week of PGHE. I think a lot of you we have met virtually, and most of you have received my emails. So just to introduce myself, my name is Enock Rwamuza, and I co-lead the deputy director for this course, Principles of Global Health Equity, along with Dr. Fedra Henry. And I'm going to have the pleasure to be taking you through the neoliberalism session today. So this session is very important. It's a very important session, as you have read and in your pre-readings, as well as the readings you have made through global health. So neoliberalism is central piece when it comes to global health and how it has affected a lot global health delivery. So today we're going to kind of like go through this session together, and I'm glad to be with you in this session. So to start off, I wanted to give you an overview of what we will be looking at throughout this session. So first, we want to understand the history of economic ideologies. This session is going to be looking at some theories that have to do with economics and how it applies to health. So I will try to be intentional in terms of explaining all these different terms. But we need to look at the history of economic ideologies. We then look at the World Bank and structural adjustment programs. These are programs that most of you have read. So we're going to look to take a closer look at them and look at the role of the World Bank when it comes to these structural adjustment programs. And then we're going to look at the impact of neoliberalism on healthcare delivery, and then we'll end with a quick case study in Neno District, Malawi. So that's about an overview of what we're going to be looking at today. So before we dive into this session, I wanted to kind of take you through the history of economics and where the term neoliberalism comes from. So in the 19th century, there was this theory that was kind of purported by different economists, but Adam Smith being one of the biggest names. So in the whole, the theory suggests that it's also called laissez-faire economics or free market economics. And it basically says that markets will produce the quantity and types of commodities, food, clothing, and otherwise, and services people desire and are willing to pay for. So, for instance, this basically meaning that the market or people who are producing different things, they will produce services and commodities that people want and are willing to pay for. So for instance, I give an example. Let's say if you're a farmer, you're producing bananas and you're selling a banana for $10. It's really hard for you to get any customers because that's not a price that your customers are willing to pay for. But because of competition, there are other farmers that are producing the same crop. You might find that the price of a banana is, let's say, $50, which is a fair price, let's say, that everybody is willing to pay for. Excuse me. So this idea of the market producing the quantity and types of commodities that people want and are willing to pay for is very important when it comes to this free market or laissez-faire economic theory. So that is called economic liberalism, and that's where the term neoliberalism we're going to see where that term comes from. So to Adam Smith, as I was saying, was I think a British economist who came up with this economic liberalism idea. And there's some of the things that they wanted to make sure that happens is that private ownership of means of production. So at that time, a lot of means of production was owned by the government. So the machines, the industries were owned by the government. So they wanted to privatize that. So the private people own, the private companies own that. And also there was they wanted to kind of like promote free trade, so people should be able to freely trade amongst themselves. And then they wanted to limit the government intervention, so the government should have little intervention when it comes to the market. They shouldn't intervene as much to regulate the market, because in free market, the market regulates all the prices, and they always come to equilibrium because of this theory they call the invisible hand. One thing that I wanted to mention that these guys or the pioneers of economic liberalism were in favor of include public provision of some goods like education, and they also were for some regulation to preserve free and competitive markets. So they wanted the government to provide these public goods such as education, but also some regulation. So, for instance, you know that even in the US, you still have things like the people who deal with taxation, people who deal with Food and Drug Administration, for instance. So these regulatory agencies that are necessary to keep the competition free and competitive. So that's okay as long as the government isn't intervening or obsessively intervening in the market system. So in the 1930s and 1970s, there was a rise in what they call Keynesian economics or welfareism, which was pioneered by this guy who was an English economist named John Maynard Keynes. And this was a response to the Great Depression of the 1930s, and it was also in response to the Second World War that was just ending. So there was high unemployment, but also people were coming together. There was social solidarity as well. So people were coming together and realizing that these atrocities that happened, like the Great Depression, the World War, they affected almost everyone. Nobody was spared from these atrocities. So there was this solidarity that was kind of like coming together. So Keynes really his theory was that government should ensure full employment and public works in times of recession to increase demand, also known as stimulus. So he came up with this idea that there should be more government intervention, that the government should actually intervene. So because after the World War and after the Great Depression, there was high rates of unemployment, and the countries have been destroyed. But when the government intervenes, then that kind of like the roads are made and all this, and then it kind of stimulates the economy again. So that was the Keynesian economics theory. And then it gave rise to this welfareism idea where there was a rise of state-funded programs to guard against individual risks. Welfareism is mostly known in Scandinavian countries. You see Finland, Norway, those countries that up north where we often hear that they have great healthcare plans, everybody's taken care of. But it's this idea that government should provide health insurance, old age pensions, unemployment insurance. For instance, if you're not employed for a certain amount, I think if you lose your job for like 6 months, you still get paid for 6 months after in some countries. So that's unemployment insurance. Disability or accident insurance. This was a lot of during the Industrial Revolution, a lot of people were working in industries or mines. and the risk of accident was very heightened. So there had to be some type of insurance to guard against those individual risks. So this was the idea that was coming from this Keynesian thinking of the government intervention and state-funded programs. So this was also exemplified in some of the countries that the biggest supporters of free market economics, but this also was an idea that they started to get on board with. We see the United States introducing Social Security in 1935, and this is the old age pensions, which means that when you get old and you can't work anymore, you get payments through your pensions. Medicare, which was introduced in 1965, which is a state-funded health insurance for all citizens above 65 years of age. Medicaid, which was also introduced in 1965, which was a state-funded health insurance for the vulnerable, particularly poor women and children and the disabled. So that was the United States. The United Kingdom also had the National Health Service, also called the NHS. Was introduced in 1948. So it's universal, it's government-run system. So basically, the government employs doctors, pays for healthcare from general tax revenues, and there is no point of service user fees. But this depends on which part of the country you're in, because let's say there's NHS England, NHS Scotland, NHS Wales, and NHS Northern Ireland. So each part of the UK has its own arrangements, but it's basically something universal that the healthcare services is provided by the government, and it's state run. So then we see that in the 1940s and the 1970s, this is what we call the golden age of capitalism. So we have progressive taxation, shared growth, as well as low inequality. This is a study that was looking at income inequality in Anglo-Saxon countries. So these are the UK, US, Canada, Australia in the years, and this is the percentage of income inequality. And you can see that before the 1940s, 1950s, the income inequality was really high, but with that rise of the Keynesian economic theories, we started to see a shift, the inequality going down, and there's low inequality and shared prosperity and stuff. And then in the 1980s, we're going to see why the spike goes up again. And all this is to go back to why the idea of neoliberalism or the idea of liberalism came back after this. This also was evidenced in some other countries, not just the Anglo-Saxon countries. So South Africa, Argentina, Colombia, Indonesia, India, and China. Similar trend, we see that inequalities is getting low, and then in those years where the Keynesian economic theory was happening and the welfareism was at the highest. So after this, in the 1970s, we started to see some things happen, and one of the remarkable things that happened was the oil crisis, and this was, excuse me, this was basically as a result of the oil embargo that was put on by the OPEC nations. OPEC nations is the organization of petroleum exporting countries, usually the Arab countries, put an embargo on oil exportation to the US and other countries that were supporting Israel in the war. And this basically shook the global economy. Prices of oil went up, increased import costs. We saw decreased reserves of foreign currency. And then in 1979, again, we saw similar trends because of the Iranian Revolution, which is, Iran is one of the biggest oil producers. So this revolution meant, a drop in oil production, which led to another kind of like recession in the global economy because oil was a big thing and still is. So this didn't just happen in those countries. We saw the same trend happening in Africa. This example of Zambia is you're going to kind of look at it when you get to the global health case studies, Zambia and how other African countries as well, which this was after independence for many of the countries, and a lot of countries were trying to build their economies, and some of the things that they were using were commodities such as minerals. So a lot of countries heavily invested in mining. Precious metals which they would export and then get a lot of money. But this meant that because they didn't have strong economies, they borrowed heavily to increase production, as well as making sure that they're investing in these mining and other things that they wanted. They were building the economies with. So this oil crisis also affected these countries really, really heavily, and then we saw decreased export revenues because nobody was buying as much because of the reduction in foreign reserve currencies, but also we saw decreased government revenues, of course, because of decreased exports and increased debt burden. So a lot of these countries then started getting into debt because they can't pay the debts they had borrowed to invest in their different productions. All this was the oil crisis that happened in the 1970s, which led to a lot of these negative economic effects. So neoliberalism is something that comes in those years after a lot of, because of this recession and this crisis, a lot of people now starting to question the idea of Keynesian economics, of welfareism and the government intervention and all that. So neoliberalism, these are some things that you can use to explain what it was. Of course, as the name states, it's the new liberalism, or going back to the old economic liberalism theory that we see at the beginning. So it's the repudiation of Keynesian welfare state economics. So you're basically saying the state shouldn't be intervening in the market, reassertion of traditional liberal ideas about the market, so the free market, laissez-faire, and all those the good stuff of free market economics. Supply and demand mechanisms will lead to general equilibrium, meaning that nobody should intervene, whether the government or any other entity. Supply and demand will decide what happens in terms of prices and production of goods and services. State regulation, which also they refer to as state interference, distorts the market. So the market should be able to function on its own, and the state shouldn't be able to come in and regulate. So going back to the laissez-faire economics of free trade, so it's not simply an economic theory, then it became a political philosophy. And this is where it became interesting because neoliberalism didn't just stay, the liberal economic theories came back, but not just as an economic theory, but also as a political philosophy, as we're going to see in the next slide. So this is Milton Friedman. This was his quote in 1975. He was Nobel Prize winner in economics in 1976, and this is him talking about the welfare state or welfareism idea. If I want to do good with other people's money, I first have to take it away from them. That means that the welfare state philosophy of doing good with other people's money at its very bottom is a philosophy of violence and coercion. It's against freedom. So this is this guy who's a very well-respected economist, and he's basically poking at that idea of Keynesian economics, welfareism, of state-funded programs, because his idea is that if the government is coming in, taking your money, and this is through taxation, so they're taxing you to fund things like Medicaid, Medicare, then that's infringing on your freedom as a citizen, and that's violence and coercion. So this starts to take a political turn because the people are now starting to blame the government and showing how the government is actually infringing on people's freedom, which we know that the biggest thing when it comes to the government, when it's elected, it should be protecting people. So that's him saying that. So, and then you have these the different politicians. This on the left is UK Prime Minister and former Prime Minister Margaret Thatcher, and this is the former US President Ronald Reagan. And Margaret Thatcher in 1987 said, "There is no such thing as society. There are individual men and women, and their families." So this is that idea of in Keynesian economics. We had seen that the reason why it took a lot of people resonated with the idea is that solidarity was at its highest. A lot of people were coming from the World War, the Great Depression, but at this point, they're now kind of like challenging the idea of society and that solidarity. And former President Reagan also saying the 9 most terrifying words in the English language are "I'm from the government and I'm here to help." To help, basically challenging this idea that the government can actually help you. So this political politicization of neoliberalism or liberal ideas is what kind of like came back as neoliberalism, because this was when you're going from just an economic theory but becoming political, and it's evidenced with the speeches of these prominent politicians and other prominent figures in economics as well. So after looking at, we look at economic liberalism, we look at how the Keynesian economic theories came by and welfareism. Then we see that people are coming back to those liberal ideas from before, which constitutes neoliberalism, the neoliberalism. So we now know that the World Bank and structural adjustments were rooted in the ideas of neoliberalism, of free market, laissez-faire economics. But I wanted to kind of like take you through what is the World Bank, what does the World Bank mean for global health and all that. So just to kind of like touch on the World Bank before we dive into their structural adjustment programs and policies. So the World Bank was created in 1944, which a lot of you guys might know. The Bretton Woods Conference was at the same time as the International Monetary Fund. It opened its doors. It was founded in 1944, but it didn't open until 1946. So the structure of the World Bank is kind of like structured in 5 organizations, different institutions or arms. So the first one is the International Bank for Reconstruction and Development. And this was the arm of the World Bank that was responsible for loans that were heavily invested in physical capital and infrastructure, especially in the 1950s and 1960s. And a lot of these loans were going to European countries who had just survived the war, and there was a lot of destruction made. So most of their loans was going to rebuilding these countries and these economies, especially in infrastructure. Then International Development Association is the idea. It's another arm of the World Bank. It was created in 1960 to provide loans to the poorest countries. And usually when we hear the World Bank in our context, especially low and middle income countries, this is the arm that is usually giving loans to poor countries or low income countries, developing countries to kind of like help them in their development journey. So that's the idea. And then other subsidiaries, because we know that the World Bank is a bank, so they have other arms. So these others usually, like this one deals with the ICSID, deals with claims and settlements in case some countries are not able to repay. This international finance corporation deals with a lot of like finance behind different projects, as well as the banking arm of the World Bank, and this is for multilateral funding and other institutions. So all these are part of the World Bank, but the ones that are closely related or relevant to low-income or developing countries are usually these ones, because they're the ones giving out loans to poor countries. So the World Bank and the global health. Why is the World Bank very important when it comes to global health? I also wanted to show you what the World Bank has done for the past few years in terms of global health. So the World Bank, when it was created, it was to deal with it started as the IBRD to kind of like give loans for construction. And most of their loans just went to infrastructure and building and all that stuff. But in 1979, when Robert McNamara became the president, was the president of the World Bank, he created the institution within the World Bank called the Health, Nutrition, and Population, which focuses on health. So this was the first time the World Bank was shifting its focus towards health. So that was one thing, but also to date, the World Bank is the largest fund of global health within the UN system, more so than the World Health Organization and other UN health institutions. So that makes it a very key player when it comes to global health. And we're going to dive into this later in the following slides. And then the creation of many metrics used in global health. I think in the Global Burden of Disease lecture, you touched on DALY's cost-effective analysis. So DALY's and all that, QALYs and other metrics that we use in global health were created by the World Bank. And then it has close ties with trust funds. We know Gavi, Global Fund, all these are biggest fund of global health. In these, they're closely tied to the World Bank. And then they have good relations with the ministries of finance. We always say that the Ministry of Finance is the most powerful ministry in any country because they're the ones giving you the money. So without the money or the finance ministry, it's really hard to do anything in global health. So all these things kind of like put the World Bank at the forefront of global health when it comes to the role that it plays, because they have the power, the money, and the influence. This is why we need to understand how influential, why the World Bank and global health. We think it's a bank, but as you can see, it has contributed to global health quite a lot, and it's nice. It's important to kind of understand their role. So this is a graph that shows that. So I just showed you the HNP, Health, Nutrition, and Population funding, and this is their funding over 30 years. You can see how it started in 1980s. It was way below 10, or even below 5 billion. But as you can see, it keeps growing think as of 2015 we were at more than 30 billion. So the investment in health from the World Bank through the HNP that was created by Robert McNamara, you can see how they're taking interest in global health, and this should make them an important player in global so this is another graph that I wanted us to look at. So these are the health contribution, these $1 billion, and these are the different institutions, organizations that are closely tied with the World Bank. And then you can see that here the author says Gavi and the Global Fund are both financed by customized trust funds, or also called financial intermediary funds held at the World Bank. So that means that you have Global Fund, Gavi, WHO Core, WHO earmarked. So all this money that we see here are from the World Bank. So you can see that the World Bank is an important fund of so the World Bank and structural adjustment. So structural adjustment is stemmed from the Washington Consensus, and this was a time where people were, repudiating that Keynesian economics theory and kind of like going towards liberal economics ideas. So the structural adjustments came about to establish conditionalities that countries needed to fulfill in order to get a World Bank loan. So the three main components of this of structural adjustments were stabilize, liberalize, and privatize. I'm going to go into liberalize and privatize for the sake of time. Stabilize is very economics heavy, so we're going to look at the last two. But basically, what the structural adjustments is trying to do is making sure to allow all the good stuff of the free market, basically coming to neoliberalism and the old ideas of economic liberalism and free market. So structural adjustment, but it's explained in basically what they would tell countries that you should liberalize, which meant that you open borders to trade, you lower tariffs, you provide no trade protection for domestic industries, but which means you should be providing protection for foreign industries. So you're basically undermining your own industries or your own production by lowering your tariffs. You're basically not getting the revenues that you should get, and you're just opening borders to trade. So you liberalize your capital markets, meaning you allow foreign investment without regulation. So foreign investors can just come in without any regulation. They usually, so all these liberalizing your economy usually ends up hurting yourself as a country, which is what we have seen with the countries like Greece and other countries that have gone into a recession, usually due to these structural adjustment policies. So privatization is also means that you sell public firms to private sector, and you often without regard for potential corruption in sales. So basically, it means that you leave public services like health, education, basic utilities that includes water and other sanitation facilities. You leave all that to the market. Now imagine when you do that, when private companies come in, there is no incentive for them to provide healthcare, education to the people who can afford it. It's all about business. It's about the money. If you can afford it, you're not going to access it. So all this shows you how the thinking behind structural adjustments was very detrimental to the countries that implemented these structural adjustments. So I just wanted to go through what the structural adjustments policies meant and what the package that they were bringing with them. So, of course, that's just meant to have effects on health policies. So, the effects of neoliberalism is that we saw the end of Keynesian consensus, so austerity rather than stimulus in response to downturns. So, austerity is a term in economics which means that austerity means that the government cuts spending and increases taxes when in times of recession. So when you experiencing a crisis, instead of Keynesian, a whole idea of what the government should step in, should increase spending in order to kind of like stimulate the economy back. Austerity says the opposite. It says that the government shouldn't spend, it should increase taxes, which means that spending is going to be very low, and that affects the economy and the people at large. But also, it was very crucial that it came at a time where the neoliberalism or structural adjustment policies came at a time where drastic decreases in health spending, because a lot of the at the same time as HIV prevalence was rising in sub-Saharan Africa. So this was, we know that HIV um, came about in the 1980s, and then in the 1990s, we know what was happening on the continent, and there was a very high rise in HIV prevalence. And this was at the same time that neoliberal policies such as user fees and other policies were being introduced, refusing access to care for all these HIV patients and other poor people who couldn't afford healthcare. So we saw the introduction of user fees, for instance, in the 1987 Bamako Declaration. We saw a turn away from primary healthcare to selective primary healthcare to increase effectiveness and efficiency. And then we saw worsening of maternal and child health outcomes in countries with structural adjustment programs, and then continued pressure to privatize healthcare, education, and utilities like water. So all these are the things that kind of like happen as a result of neoliberal policies, where the World Bank and other proponents of these policies thought it was a good idea to increase effectiveness and efficiency, but ended up leading them to different results. So, the reason we have to come back to Alma Ata, so the 1978 Alma Ata Declaration, is where the people are starting to realize that health should be a human right. There should be comprehensive primary health care, and everybody should be able to access and afford health care because everybody deserves to. But when neoliberalism came and that idea, it definitely challenged. They challenged the idea of Alma Ata. For instance, UNICEF was saying that Alma Ata is too expensive for countries. We should select, some of the services like Gobi, selective primary healthcare, so fund things that are effective and that are tested only. Fund those, not the whole system, and then this rapidly undermines this whole thing of Alma Ata, of healthcare as a human right and health for all. So I'm going to go into these neoliberal policies and some of them in details, kind of like understand what we're talking about. So the Bamako initiative, as you might have read, I think in your readings, was there or came about. So they were trying to introduce user fees at point of service, and the idea behind it was that this would make health sector more financially viable by raising revenues. So um, basically saying that the health sector, so a lot of health centers, health facilities could actually gain money or gain finances so that they can run efficiently on their own without waiting for the government. They wanted to increase effectiveness and efficiency because when services are free, we know that things tend to get slow and they're not effective or efficient. And then they assumed that market prices would maximize efficiency and help achieve equity, which is seems like a very interesting idea when you introduce user fees, hoping for equity, but in their minds or in proposing this, they thought that, because the market, we saw that the market usually leads to equilibrium of prices. So they thought that the market would intervene and then uh, the price would be as low as possible so that even though the poorest can access care, which was not the case, of course. They assumed that user fees will not greatly impact ability to access care, and then there was a focus, they really wanted to just focus on access to drugs and regular contact between healthcare providers and community. So these are the things that they had in mind when they were coming up with the Marco initiative, the user fees initiative, which was all rooted into these neoliberal ideas of the structural adjustment ideas. So the effects of user fees, and the reason I wanted to bring this is because we need to understand that it's not just us talking about neoliberalism and effects of user fees in words, but when you look at health economists and what they kind of like think about all this, it can be explained in a graph. I think graphs usually give a really concrete explanation. I hope this will emphasize that effect of user fees in your minds. So basically, this is the I'm going to be looking at healthcare. This is healthcare, and then this is income. So basically, these are the poorest people. These are the richest people. And when you look at the healthcare need, which is in green, which is this line, you can see that the poorer you are, the higher healthcare you need. And the richer you are, the less healthcare you need. And then when it comes to healthcare access and quality, the poorer you are, the less access to healthcare you have. And that means also quality of healthcare is really low. And then as you get richer, you see that healthcare access, which is this line in purple, increases. So your possibility of accessing healthcare increases because, of course, you have money you can spend, and the quality increases because you can afford the highest quality of care. So what does this mean? This means that when you introduce user fees, health expenditure goes down because some of these people can't spend on health. There's less utilization because, as we saw, that healthcare access is lowest when you don't have money, when you're poor. And usually in our countries, that's the biggest population. But also we get negative health outcomes. If a lot of these people who healthcare need is at the highest, but they have the lowest access and lowest healthcare quality, then you get very negative health outcomes because a huge part of the population cannot afford to access healthcare. So this is what we call inverse care law, is that as the poorer you are, the highest need and the lowest access you have, as opposed to when you're rich, you have less healthcare needs and you have access to the highest quality, which would be the other way around, but in healthcare, it's not. So this was just to explain a little bit using graphs and health economics, kind of like understand what goes on when you introduce user fees. So I'm going to end with this study in Malawi. It was done by different authors. Emily Rowe, who taught the global burden of disease, was among the people who wrote this article, and it was done in the Enock district in Malawi, and was looking at the impact of user fees on health services utilization and infectious disease diagnosis. And I really encourage you to kind of read through it. So basically, a little history about Malawi. And since its independence, Malawi has been one of the countries that have resisted user fees. But in 2013, four health centers in Neno district introduced user fees, and then we saw a decrease in total attendances. We saw reductions in observed new cases of malaria, which makes sense because malaria is if people are not coming to the hospital, then cases are going to go down, and then reductions in observed cases of HIV. In 2015, they abolished user fees, and then saw an increase in total attendances. Basically, the paper shows that the percentage of attendance became or restored to what they were before user fees. And then we saw an increase in diagnosed malaria cases, of course, because there's more attendance and more people coming to the health center. And there was no significant increase in diagnosed HIV cases, and this was attributed to the decreased HIV funding from donors, especially at the time when they were doing the collection. But all this shows you an actual on-the-ground reality of what happens when you introduce user fees. So that's why I wanted to finish, but also I wanted to kind of like leave you with some thoughts. Because when we think about this neoliberalism idea and different things that are happening in global health, how should global health practitioners, which you guys are and are going to be global health practitioners in the future, engage with the private sector or other development partners? We see the World Bank, and it's one of the most influential key players in funding our health programs, and we've seen ties to Global Fund and government, all that. How do we engage with these people? Because at the end of the day, we were going to work with them, where as governments that we still need their help. How do we engage with them? So kind of think through this after this lecture and after your readings, and kind of like try to think about all these scenarios and how steps that could be taken. And then how do we avoid the unanticipated consequences of progressive action as future global health practitioners? We saw that for them, neoliberalism and this whole structural adjustment ideas for UNICEF, the World Bank, and other institutions, they brought them actually thinking that they will lead to equity and they will lead to more effectiveness, more efficiency, but we saw what it has led to. How do we make sure that as global health practitioners, we avoid these consequences? Because this is an example of unanticipated consequences of progressive action. And then lastly, how do we make sure that our countries and communities are not losing focus when it comes to achieving universal health coverage? This is something we're going to come back to when we dive into health financing and universal health coverage, but start to think about this. We saw that user fees has really stalled countries progress to universal coverage because we were not allowing the poorest, and then the equity wasn't in the picture when those policies were being implemented. So how do we think about these questions? And yeah, so I wish you a good luck with the rest of the semester, but also kind of like think through these ideas, read more, and always feel free to reach out when you need any help. But yeah, that's it. That's all I have for you for neoliberalism and the World Bank structural adjustments. I hope you gain an idea of where the whole neoliberalism comes from, and its effect that it has on global health delivery, and how we can avoid that in the future. Thank you, and have a wonderful day.